Now we're going to tackle sinusitis. Sinusitis is defined as the inflammation of the mucous membrane lining in one or more of the paranasal sinuses. Acute sinusitis lasts less than 4 weeks, and chronic sinusitis lasts more than 12 weeks.
The pathogenesis of sinusitis is multifactorial and can have anatomic, systemic, or environmental etiologies. With that being said, viral infection causes approximately 90 to 98% of all sinusitis cases. Types of sinusitis include bacterial, recurrent or unresolved, fungal, and autoimmune reactions.
Predisposing factors for sinusitis include a recent URI, allergic rhinitis, cigarette smoking, air pollutants, cystic fibrosis, asthma, neoplasms, trauma, diving and swimming, and flying or rapid changes in altitude.
Common symptoms of sinusitis are as follows: mucopurulent purulent rhinorrhea, headache, facial pain, dental or ear pain, loss of smell, and nasal congestion. Less common symptoms include fever, malaise, cough, halitosis, periorbital edema, and hyponasal speech.
It's important to consider the presence of a foreign object in the nose of a pediatric patient presenting with symptoms of sinusitis. The diagnostic workup relies largely on obtaining a detailed history and performing a physical exam. If the patient fails initial treatment, workup should be more expansive. Consider skin testing for allergies, testing to rule out immunodeficiencies, and a nasal endoscopy to detect abnormalities in the nasal passage, and a CT of the sinuses to view the extent of the inflammation and disease into the paranasal sinuses.
Remember, as a nurse practitioner, it is important to identify any potential differential diagnoses when seeing a patient. Common differential diagnoses to consider in the patient who presents with sinusitis symptoms include headache, rhinitis, nasal polyps, TMJ, trigeminal neuralgia, tumor, and autoimmune disease.
Treatment options for acute viral sinusitis include supportive care, over-the-counter oral and topical decongestants, and nasal saline. Augmentin is considered the first-line treatment of bacterial sinusitis. Additionally, nasal corticosteroids and antihistamines can also be utilized.
Advise the patient to apply warm compresses to the face to help with discomfort, avoid allergens and irritants such as smoking, and use humidifiers, especially during the winter months.
If there's no improvement within 5 to 7 days after seeing the patient, consider extending the treatment or changing antibiotics. If you suspect that the patient's sinusitis is spreading intracranially or intraorbitally, immediately refer the patient to the hospital for evaluation. It's important to note that chronic sinusitis in the geriatric patient can affect their cognition. Evaluation of their renal and hepatic function before prescribing medication is key.